Starting tomorrow, DHS will begin reporting current case counts of the COVID Delta variant. Since April, there have been 26 cases of it in Wisconsin, but now that there's evidence that this variant is more infectious, it's being watched more closely. Amanda Quintana shows us what that means for those of you who are vaccinated and those who are not.
The nature of any virus is to figure out a way to keep on living and to keep on infecting people.
That's exactly what the COVID virus has done, mutating into the Delta variant that sticks more easily and tightly onto cells, creating a greater chance the person gets infected.
It will prey on people without the vaccine, and so you definitely have to be concerned.
Dr. William Hartman at UW Health says you might think the mask mandates being removed means we're back to normal. But remember, masks are only optional if you've been vaccinated, and there are still a lot of people who aren't yet.
We do have half of the country vaccinated, but that still means, that there's 180 million people in the U.S. that it could still infect.
Even in Dane County, with almost 70% of people vaccinated, there are still pockets of communities that are vulnerable, such as the Black community at only 34% with at least one shot. The good news, if you are vaccinated, the vaccines are proving to be effective. But with evidence the Delta variant is more infectious, that means it spreads quicker, creating more of a chance for large outbreaks among the unvaccinated, including young kids.
It went from about 6% of cases to greater than 91% of cases in the UK very, very quickly. And even here in the US, last week, it was around 6% of cases. Now it's at 10% of cases.
While it's more contagious, experts just aren't sure yet whether this variant makes people more sick.
There may be many more cases around that perhaps their symptoms just aren't sick enough for them to go to the hospital or think that they need to get tested.
Amanda Quintana, News 3 Now.
Dr. Hartman says if you have family members who are not vaccinated, such as children under 12 who aren't yet eligible, it's important to remember the mitigation efforts we've been talking about the whole time, washing your hands often and wearing a mask. And if you can, get vaccinated.